Hi, my name's Elizabeth Quinn, and I'm a family physician at the Lynn Community Health Center. A big part of my job is taking care of pregnant women and their babies after they're born. I'm also pregnant with my second child, and I decided to be vaccinated against COVID. I know there have been questions about the safety of vaccination for women who want to become pregnant and women who are pregnant. So I wanted to answer a few questions about how I made my decision and how I'm counseling my patients. First, some people have wondered whether these vaccinations could have any impact on fertility. There is no evidence that there's any impact on fertility from these vaccinations. There's also no theoretical way that these types of vaccinations could end up causing an impact on fertility. So that's why most physicians are recommending that women who desire to become pregnant in the next year consider getting vaccinated as soon as possible. For women who are already pregnant, and I know for me, one of the things I realized was that being pregnant put me at higher risk of having a more complicated, more serious case of COVID. We know that pregnant women are at higher risk of having a serious infection that lands them in the hospital, and that can lead to problems during pregnancy, such as preterm labor. So the COVID risk for pregnant women is something that we take really seriously, and that I took really seriously as a pregnant doctor during the winter surge. Knowing that, finding a way to protect pregnant women from these serious complications is really important. So when I was deciding about whether or not I wanted to be vaccinated, I looked into the vaccines to understand, was there any way that I thought that this vaccine could harm my pregnancy? There are very few ingredients in the COVID vaccines. That's part of why they have to be kept so cold. And so there was really no kind of theoretical way that we thought that any of these vaccines could impact or harm a pregnancy. Moreover, since December, when we started vaccinating people across the United States, we have been keeping track of the people that we've been vaccinating and any side effects they've had. We've vaccinated millions of people with the Moderna and the Pfizer vaccines without showing significant side effects. Additionally, we've vaccinated at least 35,000 pregnant women, and I am one of them, and have kept track of any side effects that they've experienced during their pregnancies. And there is no sign that any of the pregnant women vaccinated have shown impacts on their pregnancies. So for these reasons, I have been strongly advocating that women who are pregnant, who are thinking about becoming vaccinated, talk with their doctors about their COVID risk and strongly consider these vaccines during pregnancy. We also know we have some new studies that are showing us that pregnant women can actually pass antibodies from the vaccines to their unborn babies and then to their born babies via breast milk after delivery. And so for both of those reasons, I'm hoping that my daughter will get some protection as well. Please, if you have any questions about vaccination during pregnancy, reach out to any of the providers at Lynn Community Health Center, and we would be very happy to talk to you.